Wes Streeting, you've got a big speech coming up. Tell us about it.
So this is the general election year, and the NHS is going through what is objectively the worst crisis in its history. And I think the biggest opponent or obstacle Labour face this year isn't the Conservative Party. I think, frankly, people have had enough of them. It's cynicism, and perhaps even more seriously, a fear about whether anyone can take the NHS from where it is, record waiting lists, lowest patient satisfaction in history, and not just get it back on its feet, but make it fit for the future. And my strong conviction is not only can Labour, as the party of the NHS that founded the NHS 75 years ago, live up to that task, only the Labour Party can be trusted to do it. And I mean, the analogy I often use is, just as only Nixon could go to China, only Labour can be trusted to reform the National Health Service. And that is part of the challenge. You'll never find people short of ideas about how to spend more money in the NHS. And I don't pretend that there aren't resource pressures. But there's also a lot of waste. There are some serious questions about how care is organised in this country. And unless the system reforms, it will not survive. And I really do think it is that existential. And so what Labour's setting out ahead of the general election is a plan to get the NHS back on its feet, but also to reform the NHS to make it fit for the future. Living up to those founding principles as a public service, free at the point of use, but making sure we deal with some of the grotesque examples of not just wasted money, but wasted lives and opportunities. For example, if someone can't get a GP appointment, which would cost the NHS £40 to provide, because there are thousands fewer GPs, they end up in A&E, which costs £400 and overwhelms emergency departments when there are people waiting for care. So that's just one example of how we need to shift how healthcare is delivered, where it's delivered, not only to deliver better outcomes for patients, which is the most important thing, but also to deliver better value for taxpayers' money.
You've identified £10 billion of waste that you want to target. It's a drop in the ocean, though, isn't it? Compared to a budget of £190 billion. Is this really going to make any difference?
Well, I think when you look at the challenges right across the public sector at the moment, and actually look at the pain that people are feeling in their pockets in terms of the cost of living crisis and the tax burden being at its highest in around 70 years, £10 billion isn't small change, it's a lot of money. And I want people to know that when Keir Starmer and Rachel Reeves talk about the value of taxpayers' money and treating taxpayers' money with respect, that's not just a nice sentiment or a soundbite from two of our leaders of the Labour Party. That is a conviction that is shared right across the shadow cabinet and right throughout the Labour Party. And especially for those of us who come from working class families, you really do understand the impact that the tax burden, and it does feel like a burden at the moment, has on families, especially when you haven't got a lot of money. And so if we are taking money from people through tax, we have a responsibility to spend that money as carefully as the families who are sat around the table at the moment, itemising the monthly income and the outgoings and realising there's more month than money left.
But you've identified £10 billion of savings, but things like A&E, not having enough beds, missed GP appointments, inefficiency in the system. Isn't the problem that £10 billion of problems you've identified is going to take multi-billion pounds to fix the underlying problems? It sounds good that you're going to do a red tape challenge and find waste in the system, but what you really need is a lot more cash to make the system work.
I'm not convinced that the answer to the crisis we see in the NHS is pouring ever increasing amounts of money into a system that isn't working effectively. Where we think that money can make a difference, we've spelt that out. And don't get me wrong, we've made some significant commitments to invest in the NHS, £1.1 billion to provide 2 million more appointments a year through extra evening and weekend working. We know it can work because it works just across the river at Guy's and St Thomas's Hospital. I saw it working in action in Leeds. But it should be working in a couple of hospitals in big cities. It should be working across the country. And that's £1.1 billion that will go into the pockets of hard-pressed staff. And we know from experience that people are willing to do it voluntarily, choosing to sign up in exchange for extra money for the extra shifts. And that can provide 2 million more appointments a year. So that would make a real difference to cutting waiting lists. If we provide mental health support in every primary and secondary school and community mental health hubs in every community, another one of our fully costed, fully funded plans, not only does that mean better support for young people, and they're less likely to hit the crisis point of A&E departments, self-harm, worst case attempted suicide, it's also easing the pressure on GPs that are overstretched. It's easing the pressure on A&E departments. It's also easing pressure on the police. I mean, last year, I think all bar one A&E visit I did, and I've lost count of the number of A&E visits I did last year, all bar one had at least one, sometimes as many as 4 uniformed police officers in attendance in A&E because they were attending to a mental health case because of that lack of support.
Are you ready to be the most unpopular man in a Labour government? Because that's what you're going to be. NHS is a sacred cow for the Labour Party. You're going to have unions screaming for more money. You're going to have doctors, nurses screaming for more money. Are you really the man to say no?
I don't pretend that this isn't going to be, if we win the general election, one of the most difficult jobs in government, probably aside from the job that the Prime Minister and the Chancellor has. And I am up for that fight. And moreover, yes, every time I make a reform argument, there are howls of outrage from online activists. But one of the reasons I'm so passionate about the reform argument and make the case and give the examples is because I want staff who've told me the NHS needs to change and patients who've told me that the NHS needs to change to know that someone's listened.
Do you think the Labour Party listens too much to that howl? Those screams of like activists, as you say, online, and people sort of accusing you of being, you know, a Tory in disguise and every name under the sun. Do you think that skews the debate too much?
I think there are times when the Labour Party is lent too heavily into nostalgia. And it would be the easiest thing in the world to go into the next general election just saying, worst crisis in the NHS's history, you can't trust the Tories with the NHS, you've got 24 hours to save the NHS, and by the way, here's a nice sepia film of Nye Bevan setting up the NHS 75
Isn't that
years
exactly
ago.
every single election campaign the Labour Party have done for the last 25 years?
Well, we've not done very well in the last 4 of them, so we're not planning to repeat those mistakes. I think what people want from Labour is a forward-looking argument and a bit of hope and reassurance that someone can grip this crisis and get the NHS back on its feet and fit for the future. And if you think about the policies that we've laid out, particularly in the last year, 2 million more appointments to cut NHS waiting lists, 700,000 extra NHS dentistry appointments, part of our dentistry rescue plan, the mental health in every primary and secondary school in the country with community mental health hubs in every community, strong public health measures like banning the marketing of and advertising of junk food to children, not just on normal telly but online, coming down like a ton of bricks on the vaping industry. Any one of those individual policies would make a real difference to the health of the nation. Taken together, they represent the serious foundations of a 10-year plan for reform and modernisation of the NHS.
The part the Labour Party have played in the sort of toxification of the debate about the NHS, any criticism of, you know, of the way it works or not putting more money into it, it's automatically, you know, Labour Party have accused their opponents of wanting to privatise the NHS, to sell it to Donald Trump. Do you not think that the toxicity around the debate just needs to be stripped away? And the problem is the Labour Party have played a big part in it.
Well, I think one of the problems with the reform debate is you say reform and people automatically think privatisation or, you know, and I'd privatise the NHS over my dead body. I believe very strongly in the NHS. It literally saved my life in 2021 when I had kidney cancer. But I think the problem with the Tories is they don't help themselves, and they did this massive top-down reorganisation just over a decade ago, spent billions of pounds in the process, really did the system a lot of damage, and it took successive Tory Prime Ministers time to try and unscramble that. And when you talk to the Tories now about what reform should look like, what it should be, they don't really have any answers, and they're frightened to go near it. And I think that comes back to the sort of core argument I make, that it will fall to Labour to reform the National Health Service. I think it's commonly accepted now that Labour's plan isn't just about investment, important though that is, but it is also about reform and modernisation. And I think because people know that we share the NHS's values, the principle of an NHS that's free at the point of use is sacrosanct for Labour. I think that builds a lot of public trust and confidence to shift the way we deliver healthcare in a sort of radical and reforming way we need, because too much of healthcare is concentrated on hospitals. We need much more focus on primary and community services, mental health, social care. We've got to shift the NHS from being an analogue system to more of a digitally data-driven system.
200 million quid's worth of stamps.
And yeah, exactly. I mean, hundreds of millions of pounds on stamps, and you look at paper. I mean, the fact we still got pages. In fact, I was shocked. There I was at Alderhay Children's Hospital, one of the best in the country with care, downstairs in their basement, in their incredible innovation lab, where they are coming up with all sorts of new cutting-edge treatments and technologies, using data in a really smart way. And one of the consultants said, but just so you don't think all of this stuff is where we are, here's my pager. And I genuinely thought he kind of kept it as almost like a kind of nostalgic souvenir. It is a working pager that that he's still using in the 21st century. Even the Labour Party whip's office doesn't use pages anymore.
But how do you say you've got 10 years to turn this around, less than 10 years to turn it around, you've got a 10-year plan. How are you going to do this? By the middle of this decade, 40% of day-to-day public spending, more than 40% of day-to-day public spending, is going to go on the NHS. Completely unsustainable.
And that's the other reason why I keep an eye on the finances and why I take this seriously. I think if you go much beyond where we are in terms of healthcare spending as a proportion of government spending, people will start to ask really fundamental questions about the sustainability of the NHS. And that's why we've got to shift to the prevention side, preventing ill health, reducing preventable illness, and also make sure the money that already goes into the NHS is money that's well spent. Because the other thing I think about a lot, and we have this conversation in the shadow cabinet because we know money's going to be tight. That's why you will not find Rachel Reeves and Keir Starmer making loads of big spending pledges, because we know that the public finances are tight and so are family finances. So you can't even say, well, okay, but it's the NHS, let's ask people for an extra penny on national insurance as the last Labour government did. People can't afford it. The thing I'm struck by is for every penny that Rachel Reeves decides to allocate, there's an opportunity cost for someone else. And so what we can't do, and what I'm trying to shake the NHS out of, is just have an assumption that because it's the NHS, it automatically is the sort of first port of call for every new bit of government spending. Because when I think about the things that really do determine our health and well-being, our life expectancy, sure, the NHS and the Department of Health has some bearing, but actually most of the things that determine our health are things like our housing, our employment, our education and skills. And those are all areas where, if I talk to my colleagues in the shadow cabinet, they would find no shortage of good ideas about how to improve decent home standards so you don't have kids living in mould-infested bedsits. Bridget Phillipson will talk about how crucial early years are for working class kids from backgrounds like ours, and the scandal of rising child poverty in our country. Now, that's something that's going to require money. So I feel a responsibility, before I go knocking at the door to ask Rachel Reeves for more money, to be able to look her in the eye and say, don't worry, every penny that's going into the NHS is money that's being well spent, and we are at war on waste in the NHS. And I think that I'm pushing an open door here, because the thing that has inspired me most in terms of the reform agenda are the staff working in the NHS who are telling me how they can improve the lot of their patients. And whether that's GPs who are bound up in countless accountability measures, many of which are fairly redundant. The Vice President of Royal Society of Radiographers, who says he needs 7 passwords to log into the system for one patient. we can find many more of these
You're
examples,
making it
and I
sound
think
very-
I'll be pushing an open door on people who want
You're
to help
making
me
it
do
sound
that.
incredibly easy. I've interviewed countless health secretaries, countless shadow health secretaries, in fact, and they've all come in with this great noble ambition of no more money, but reform, fixing the problems, and you just get bogged down in the giant bureaucracy of the NHS. What makes you different other than being, a Labour man? What really makes you the person that's able to do what all of your predecessors have been unable to?
Well, I just ask people to bear in mind that the last time Labour was in power, we delivered the shortest waiting times and the highest patient satisfaction in history. And the lesson of that Labour government was that it was the combination of investment and reform that delivers results. And actually, in recent years, what the Tories will say, and actually they'll say it in the tea room as well, is we poured all this money into the NHS and we're just not seeing results. Well, no, because you've not got the reform agenda to go with it. You can't just keep on pouring ever-increasing amounts of money into a leaky bucket. You've got to deal with the bucket itself, and I think that's what they've failed to do. I am also blessed with that, with the support, the guidance, the wisdom of every Labour health secretary who was part of the team that delivered those waiting times, record waiting times and high patient satisfaction. And actually, for all of the howls of outrage and protests on social media, which to be honest is water off a duck's back, I am constantly reassured by the people working in the health service that brighter future we describe is possible. Because if you take any one of our policies, what we have done is identify best practice in the NHS that is proven to work, proven to deliver better outcomes for patients, proven to deliver better value for taxpayers' money. And the question and the challenge I pose to the system is, if you can do it in one hospital, why aren't you doing it in all hospitals? The NHS has more pilots than the RAF. They would do a lot of good if they started doing adoption and rollout. We got to take the best of the NHS to the rest of the NHS, because I'm not messianic enough to believe that me sat behind one desk in the Department of Health is going to solve all the nation's problems. It is about having the right plan and the right team and mobilising people with the right support to get the NHS back on its feet, fit for the future. And that's my mission in politics.
So say you do win your next election, your health secretary for you come back and tell our Sun readers in a year's time, after a year in office, that you wouldn't have put their taxes up to pay for NHS. You would be on your way to reforming the system, waiting lists will be down, no more strikes. What's your benchmark for success a year in?
Yeah, I'll come back and tell some readers that. I mean, by the end of the first term, I want to have seen a serious reduction in NHS waiting lists, and I'd want to see the performance standards of the NHS in terms of things like ambulance waits and A&E waits back to the standards that we expect. That's not going to be easy. These are big ambitions, but I'm confident that we can get there. And I think that people are desperate to see the NHS moving in the right direction.
And apart from non-dom loopholes and VAT on tax, no more taxes for the NHS.
But that's the thing. Where Rachel has raised money for good and impactful spending commitments, it's been driven by fair choices. So the non-dom tax revenues, for example, which we estimate a conservative, small c conservative £2 billion, 1.6 billion to the NHS, the remainder going to primary school breakfast clubs, so kids start the day with hungry minds, not hungry bellies. Baked into both of those planks, how you raise the money, where you spend it, is fairness. It's not right to keep on asking people on low and middle incomes to pay higher taxes when they're struggling. And it's not right that they don't get much for the money that they're putting in. I mean, take breakfast clubs, for example, as well as the nutritional benefits for kids, the social value to the start of the school day. You think about the parents that are run ragged in the morning trying to get their kids ready off to school and then get themselves off to work. Having that extra hour in the day, the start of the day, to drop the kids off safely, that's actually a really big difference for families. Similarly, the 2 million more appointments a year that we'll be able to fund to get the waiting list down. If you are off work, sick because you're waiting for your knee replacement, or your life is ruined because you're waiting for a hip replacement, that's going to make a really big difference to your life. And this is the other thing, Rachel Reeves and I are absolutely in agreement on. Health policy, important in and of itself for us and our health. It's also an economic policy. If you've got sick note Britain on NHS waiting lists. That really hurts economic growth, and I think the Conservatives have been too slow to understand that.
Wes Streeting, thank you.